I'll show you a little bit of animation. This is the fracture. Now fracture has been reduced. Now you are just holding that fracture with the reduction with a clamp or maybe multiple or 2-3 K wires. Thereafter you are passing this 3 Gujarat guide exactly where this trajectory should be there. It should be about 8 to 10 distal to the exit articular margin so that we have enough space for the head of the screw to be engaged in well position, and it should be little distal to the capsular attachment. Over this guide pin, Gujarat guide, we are putting this blunt guide pin, and then both of them they are drawn to the opposite side, and that we can discard the Gujarat guide. So now inside there is a blunt guide pin in the same path. Then we just make that path wider by this drill bit which is cannulated, and thereafter we try to push on one side this depth gauge, gauge stopper. Other side we are putting the depth gauge. So when we do like this, we are able to find out what is the size of the screw, the total bolt, the total length of the bolt. And thereafter, we try to do tapping so that all soft tissue, all these things can be removed, and there is a completely good passage for the male and female component. And then on the selected side, on one side, we can put this female part which goes in, and on the other side, the male part. And maybe through IITV, we have to try to see that they are engaged well inside. And once they are engaged well, you can remove now the clamp. And once you push it, they are engaged, and then it will get a compression. So I think this is making very clear the steps of passing this Ahmedabad bolt, which is very important. Unless you follow all these steps, there are chances that you might not be able to engage it well, or it may be a improper size, or sometimes you fix it so much that it's difficult to unscrew. All those cases you have to be very careful, and we have to see that the overlapping of the threads should not be complete. At the end, there should be something which is left so that we know that is a good compression which has been achieved.